Hello students, I am Dr. Vijayshri and today we will discuss about illness anxiety disorder and I will be discussing this disorder in Hindi as well as in English language. In this lecture we will cover certain topics, that is nature and overview, onset and prevalence, signs and symptoms, diagnostic criteria, and possible causes of illness anxiety disorder. Okay, now let's start the discussion about illness anxiety disorder, which is a type of somatoform disorder which was earlier known as hypochondriasis in DSM-4 and now it is named as illness anxiety disorder in DSM-5. The term was renamed because it was considered as a derogatory or disrespectful word for the patients. So the term hypochondriasis was replaced with illness anxiety disorder in DSM-5. Now, let's have an overview. We can understand the nature of illness anxiety disorder by the name itself. Illness anxiety means persistent anxiety or fear of being ill. एक ऐसी मानसिक स्थिति जिसमें व्यक्ति के मन में लगातार यह भय बना रहता है कि उसे कोई गंभीर बीमारी हो रही है या होने वाली है. The person may believe that the normal body sensations or minor symptoms like cough, cold, sneezing, fatigue, muscular pain, etc. are the signs of severe illness. छोटी मोटी या साधारण सी बीमारी के सिम्टम्स होने पर व्यक्ति उनको किसी गंभीर बीमारी से जोड़कर देखता है और बहुत ज़्यादा परेशान और भयभीत होने लगता है. Now, coming to the onset and prevalence of illness anxiety disorder. It is most commonly begins during early adulthood and appears to occur equally among men and women. It is a long-term condition that can fluctuate in severity. It may increase with age or during times of stress. Okay, so let's discuss the signs and symptoms of illness anxiety disorder. The very first symptom is that the patient has a persistent preset in his mind of developing a serious illness. Then there is a lack of physical symptoms, and if certain physical symptoms are found, they are mild. The patient shows the health anxiety behaviors like he used to check his health symptoms regularly on internet whether he is ill or not. Okay, so the next symptom is that the patient use medical facilities or medicines either in excess or he does not use it at all. या तो वह मेडिकल केयर और मेडिकल फैसिलिटीज़ का बहुत ज़्यादा इस्तेमाल करता है या फिर बिल्कुल भी नहीं करता. There is no delusion or psychosis and there is clinical distress or functional impairment with the patient. Other than the major signs and symptoms, there are certain common behaviors which has been done by the patients of illness anxiety disorders, and these behaviors include finding little or no reassurance from doctor visit or negative test results, worrying excessively about a specific medical condition or risk of developing a medical condition because it runs in the family, having so much of distress about possible illness that it's hard to function, repeatedly checking the body for signs of illness and disease, avoiding people, places, or activities for fear of health risk, constantly talking about your health and possible illness, and frequently searching the internet for causes of symptoms or possible illness. Now we will discuss the diagnostic criteria which is given by American Psychological Association in DSM-5. There are total 6 diagnostic criteria of illness anxiety disorder given by APA, All these criteria have already been discussed by us in the symptoms slides, so I don't think there is no need to discuss it again. One important thing here is that in the last of these criteria, we have to specify what type of medical care has been taken by the patient, whether it is a seeking type medical care or it is an avoidant type medical care. Seeking type medical care in which patient regularly visits to his physician or he is going through different tests or procedures, and the avoidant type medical care when the patient rarely visits to his physician or does not take any medical care. Now, coming to the possible causes. When we talk about the causes of illness anxiety disorder, though the exact cause is not clear, but there may be certain factors like belief system, family, and past experiences of the person, which may play an important role in developing illness anxiety disorder. So, we cannot ignore or avoid the belief system, the family structure, and overall past experiences of the patient. So, this is all about illness anxiety disorder. We discussed the nature, prevalence, signs and symptoms, diagnostic criteria, and causes of illness anxiety disorder, or we can say hypochondriasis. I hope this lecture will be helpful for you. Stay safe and take care of you. Thank you.